This program is made possible by CIC Insurance Group. We keep our word.
It is a pink affair in Doctors on Call. Thank you so much for joining us where we are live on Family TV and Radio 316 as well. It is Breast Cancer Awareness Month, but we are using the same platform to create a general awareness on cancer. We are not going to relent on stressing much about cancer. So I have panelists for the evening who are going to help us in creating that awareness and also giving us advice in putting up fight against cancer. On to my first guest. She is a psychiatrist. Her name is Dr. Catherine Mutisya. You've seen her on the show before. Dr. Welcome to the show.
Thank you.
So, Dr. what you're going to do, with you, we're going to try and understand psychological stress as a result of cancer. So I'm looking towards an engaging conversation with you and for our audience as well. Once again, thank you for coming in onto the show. Now, on to my second guest. The reason why I'm telling you cancer, the numbers are growing day by day. He was sharing with me just before we went on air. He has a practice in Nairobi and Eldoret as well. And in Eldoret, on a singular day, he can see up to 140 patients. This is in a day. Today, he has seen over 30 in Nairobi. This is just one doctor. Now, this tells you how much cancer is growing. I don't want to scare you off. But what we want to do is to create an awareness because 90% of all types of cancer can be curable if detected early. Now, oncologist for the evening is Dr. Fredrick Chite. Welcome to the show.
Thank you so much for having me.
So, Dr. what you're going to do is to understand the forms of cancer, diagnosis, how the treatment process is, and screening and test as well.
Sure.
So there you have it. That's my panelists for the evening. Remember, I want you to ask Dr. Mutisya, Dr. Chite, all the questions that you might be having. Kindly let us set the record straight. When it comes to your health, there's no silly question. Now, you can do so via SMS 22316. Give us a call on 0204 200 000. If you prefer social media, then the better. Our Facebook page is Family TV, and we have a blog, by the way, which has provision for you to ask your questions. That's familymediaonline.com/docblog. Dr. Mutisya, I'm going to start with you. Ladies first, they do say. What are some of the psychological disorders that come as a result of cancer?
Thank you very much. I would want to look at it broadly in the sense that at the point of diagnosis, when the diagnosis is made, then there are certain psychological issues which can affect the person at that point and the family. It could start from even the shock of getting the news, that some people might go into denial, bargaining, and eventually acceptance. So that's at the time of diagnosis. The same might also be experienced by the family members. Then as we move on at the point of treatment, because the treatment usually sometimes it can be very disfiguring, sometimes it can be very severe. So also you expect some reactions at that point. Again, there's a lot of anxiety, a lot of depression. If you look at the family, roles might change, like a mother who was a caregiver might now have to rely on older children to take care of her. A father who was the breadwinner might have to sit back and other members take care of them. So there's change of roles. There is also some people even start questioning their spirituality. So there are many factors at the point of diagnosis and the point of treatment.
And we're going to discuss in detail what you have just stated. Once again, welcome to the show. Dr. Chite, it is Breast Cancer Awareness Month. And what are the things that we should look out for, possible symptoms? And as a man, do you also need to go for breast test as well?
Yeah, so I usually say there are multiple things that are high risk factors for breast cancer, but you can categorize them into two specific ones. One is age and two is being female. So we are not saying that men cannot get breast cancer. Men can. And although 99% of breast cancer is in women, but 1% is in men. So men, we don't normally routinely test for them and screen for them. But what I can advise is that if any man sees any mass or any swelling on the breast or any discharge from your nipple, it's important for it to be checked. What I'm saying, and this is important for the public to know, is that not every mass on your breast or any swelling is cancer. It's only when we actually get a biopsy and check it on a microscope that we can say whether it's cancer or not. For women, on the other hand, one of the greatest things in our setting, and I really try to struggle this with quite a number of physicians as well, is the fact that breast cancer in our setting is earlier and earlier than it is in the West. So my average age of a breast cancer woman in Kenya is about 38 to 42 years old, while if I was in the US, the average age is about 70 years old, 68 to 70. So therefore, the screening guidelines that are used in the US of where we are talking about 50 years old or 40-year-olds and above may not necessarily apply. So I usually tell women in Kenya that start screening early. And you can start with just simple things like breast self-exam, clinical breast exam. Make sure you go to a doctor and ask the doctor, how can I actually do breast self-exam on a monthly basis on my own? And it's important for some of the things you note on your breast. Know your breast size. If you notice that one breast is bigger than the other, we are not saying it's always cancer, but make sure that it's checked out to figure out what it is. If you notice that the breast is getting painful, you're having some discharge, whether it's a bloody discharge or a different color of discharge from the nipple, we really need that to be investigated. Sometimes it's all about nipple eversion or inversion. What we mean is that the nipple, instead of pointing upwards, it can point sideways or start pointing inwards. That could be a sign that it needs to be looked at. And one of the most important things is that know that you can have all these signs and it's not breast cancer. But it's important for you to be evaluated. And for us, if we see any lesions at all or any swellings, we biopsy those. And that is the only way we know.
Dr. Chite, yes, I really want to go for that test, but where can I?
Oh, this is a good question people keep on asking. So part of what he probably had told you, I also work at Moi Teaching and Referral Hospital, and we do breast cancer screening daily. With clinical breast exam. Obviously, there are other forms of breast cancer screening that are really of high value, and actually they are able to detect, and they are very specific and sensitive in terms of detection of breast cancer, like having mammograms being done or MRIs being done. But I would say just take the first simple step of going for a clinical breast exam. Okay. Quite often, I get a lot of women who present and they have very late stages of cancer. And as you rightfully said, if you screen and diagnose these cancers early enough, then most of them can be cured. The cure rate is very high. The cure rate goes down depending on how far it has spread. And usually it's in stages. So stage 1, usually it's actually very early. Stage 2 is still early, but you know, you are getting there. Stage 3 is locally advanced. So it has advanced, but it's just local. And stage 4 is one that has gone systemic. So I can tell you by and large, we do not cure stage 4 cancers. We can manage patients with stage 4 cancer so that they can live longer, and we can manage their symptoms and give them very good palliation, but we cannot cure it. But if we get you at stage 1, stage 2, for most of the cancers, as you rightfully said, they can potentially be cured.
Dr. Chite, on that note, just a reminder to our viewers and listeners, we are live on Radio 316 as well. I'm waiting on you to ask Dr. Chite, Dr. Mutisya, your questions on 22316. Now, I was reading on the internet, and there was a report that was released earlier on this month, and on a daily basis, we lose up to roughly 50 people. And in Kenya, we see cancer as a death sentence. So yes, I have cancer, and there's a question here. How can people who have cancer learn to cope with psychological stress?
Yeah, it is very important for people who are suffering from cancer to live positively, because it has been shown that clinically, people who are dealing with the stress well and they are living healthy, then they do better. They might, their life might not be prolonged, but they'll have quality life compared to those who have despaired, or those who might get anxious, or those who might get depressed. So it begins from the point of, once you are diagnosed to have a certain cancer, get to know all the information about this cancer, read as much as you can, ask as much as you can, and allow your family members to be there for you. Sometimes you might feel like I should be alone, but it's good to try and get social support. And what is very important is, I know we have very few oncologists in Kenya, and they might have very short time with the patient. It would be very good for every treatment of any cancer patient to have even a checklist, even if it's administered by the nurse or it's administered by a counselor, checking on the psychological aspect, because the oncologist might most of the time be concentrating on the physical. And you find that if now the psychological distress is overwhelming the patient, they might not do so well. So with that checklist at every point, at the point of diagnosis, as you choose the treatment modes, at the point of treatment, it would be good to do those checklists. Again, simple things like eating well, balanced diet, getting social support, finding exercise, and even for the caregivers, because sometimes it has been, some studies have actually shown that the spouse of a patient suffering from cancer might actually be undergoing as much distress just like the patient. Okay. So sometimes we might even forget that the carers also are going through a lot of stress. Yes.
So tell you what, doctors, we're supposed to go for a short commercial break, but right before that, briefly respond to Maggie's question. It's touching on breast cancer. She's gone for the mammogram, she's gone for the ultrasound, and the question goes, Dr. Chite, I'm 32 years old. I have had pain in my left breast for the last 2 years. There's no discharge at all. Mammogram shows nothing. Ultrasound is negative. Could it be cancer?
So this is an interesting question, and this is important. And one of the most important things that we get from this question is that not one single modality of investigation may necessarily give you all the answers. And the other thing for breast pain, it's not always related to cancer. So if you have had a mammogram, you've had an MRI, depending on what the size of the breast is, because we usually actually advise women with very thick breasts, because sometimes the mammogram may not really be very conclusive, then we usually advise them to actually have an MRI to be done in addition, so that you can actually get a lot more details of the breast. So if she has gone for all this and there is no mass that is being seen, and they've checked even in her armpits, which we call the axilla in medical terms, and they cannot really see any lymph nodes at all, then we should be looking for other causes of pain in her breast that are really different from breast cancer. Considering that it has gone on for 2 years, it's highly unlikely, but it's always important to be cautious.
Okay, on that note, we go for a short commercial break. But just a reminder, we are not only talking about breast cancer, we're going to have a look at cervical cancer, prostate, you name it. I'm waiting on your question. Talk to me on 22316. And one more thing, we always have to eat. But now the difference is you have to eat smart. Now, did you know that there are foods you can avoid so as in the end to boost your immunity? Have a look at Eat Smart. We'll be right back.
At CIC Insurance Group, we continuously strive to improve and develop new services to ensure we cater for all your insurance needs. CIC Insurance Group, we keep our word.
Scientists found that within 5 hours of consuming 21 teaspoons of sugar, our white blood cells lose 40% of their ability to kill bacteria.
We think sugar, rather than impeding your immune function directly, helps the bacteria, helps the virus, helps, in fact, the cancer cells grow faster. So it does all the things to make the viruses and bacteria prosper, which means it's harder for you to kill them all. It's a numbers game and a speed game.
Sugar is hidden everywhere, in bread, pasta sauce, and even yogurt. And it's disguised with over 40 different names, like high fructose corn syrup,
maltose, dextrose, fructose, etc. Anything that ends in an ose, that's a sugar. Anything that has the word syrup in it, that's largely a sugar. Honey is a sugar. Maltodextran. You got these weird things, organic, pressed, evaporated cane juice. So evaporated cane juice, evaporated juices, beet sugar, corn sweetener, anything that says sweetener on it.
Before you buy a product, Scan the list of ingredients for sugar or any of its aliases. You should know those immune-busting trans fats also have an alias, hydrogenated oils, which you can spot on the list of ingredients. Cookies, crackers, and other packaged baked goods are loaded with them. These bad oils are also common in snacks, fast food, and frozen dinners.
You get more spread of the virus and bacteria if you have a lot of trans fat. Those are in processed foods. And so the same thing goes with omega-6s.
Sometimes it's not just packaged food that causes problems. The packaging itself often contains chemicals, like PFCs and BPAs, that have been shown to suppress your body's immune function. Many cans and food packages lined with plastic have these chemicals, especially microwave popcorn. And if you microwave your food, switch from plastic containers to glass, paper, or ceramic.
One of the easiest ways to decide you're eating healthy is avoid food in a package that isn't in its original form. So packaged food is really bad for your health, bad for inflammation.
Fluids flush out damaging toxins, while at the same time carry nutrients to infection sites. To check whether you're drinking enough water, look at your urine. It should be pale yellow. If it's dark yellow, you need to drink more. Speaking of drinking, while water is good, booze is bad for the immune system. Research shows drinking too much alcohol reduces the ability of white blood cells to kill germs. The more alcohol we consume, the more infections we get.
The most important thing that feeds our defense system is in fact food and food choices. So what foods you have is key to whether you have a prolonged illness or short illness and whether you get sick at all.
A study in older adults showed that eating more fruits and vegetables improved their ability to fight illness. Foods especially high in immune-boosting phytochemicals are red bell peppers, berries, kale, onions, beets, garlic, broccoli, and shiitake mushrooms. Watercress is the new superfood. It's loaded with even more vitamins and minerals than spinach. So fight colds and flu with a healthy diet. One free of sugar and processed foods, but rich in whole foods and plenty of water. You'll definitely feel better from the inside out.
Always remember to eat smart. Thank you for staying tuned to Doctors on Call, where we're live on Family Radio 316 and Family TV. In case you're joining us right now, in the studio I have Dr. Catherine Mutisya. She is a psychiatrist, and tonight she's giving us an understanding on coping with cancer and psychological disorders that might arise from that. I also have the pleasure of hosting cancer specialist, that's Dr. Chite, and he's trying to give her a deep understanding on the various forms of cancer. Dr. Mutisya, allow me to start with you yet again. There are two sets of questions here. Does psychological stress cause cancer? And the other bit of question from this sender is, can keeping a positive attitude help cure it? We can start off with the first
Okay.
bit.
Psychological stress, whether it can cause cancer, this has been a very controversial issue, although indirectly